Have you ever wondered how anesthesia works and what makes it so vital in the world of medicine? Well, let's take a closer look. Anesthesia is a cornerstone of modern healthcare, providing comfort and safety during a wide range of medical procedures. It's that special concoction that allows you to sleep through surgeries, feel no pain during a tooth extraction, or even just numb a small area of your skin before a minor procedure. This incredible medical innovation is about more than just sending patients off to dreamland. It plays a crucial role in pain management, patient comfort, and overall surgical success. In this video, we'll be exploring the fascinating world of anesthesia. We'll delve into the different types, how they work, their safety, risks, and the critical role of the anesthesiologist. Anesthesia is a fascinating field, and today, we will delve deep into its different types and uses. Buckle up, and let's embark on this enlightening journey together. Anesthesia comes in different types, each with its unique characteristics and uses. As we delve into the world of anesthesia, it's important to understand that there are three main types: local, regional, and general. Each type has a specific use and differs from the others in several ways. Let's begin with local anesthesia. As the name implies, local anesthesia is used to numb a small, specific area of the body. It's the kind of anesthesia you're likely familiar with if you've ever had a minor surgical procedure, like a tooth extraction or a skin biopsy. While under local anesthesia, you stay completely conscious, but the area being treated is numb, so you don't feel any pain. Next up, we have regional anesthesia. This type is used to numb a larger region of the body, like an entire limb or a significant portion of the torso. It's often used during childbirth or for surgeries on the arms, legs, or abdomen. There are two main types of regional anesthesia: spinal and epidural. Both involve injections around the spinal cord to block pain signals from reaching the brain. Unlike local anesthesia, regional anesthesia can cause some loss of feeling or movement in the affected area, but patients typically remain awake. Finally, we have general anesthesia. This is the heavy hitter of the group. General anesthesia is used for major surgeries and procedures. It induces a deep sleep, making you completely unaware and unable to feel pain. It's a complex process that affects the entire body, not just a specific region. An anesthesiologist or nurse anesthetist carefully monitors your vitals and adjusts the anesthesia as needed throughout the procedure. In summary, each type of anesthesia has its own role to play. Local anesthesia numbs a small area, regional anesthesia numbs a larger region, and general anesthesia induces unconsciousness for major surgeries. Each type is a vital tool in the medical field, allowing procedures to be conducted without causing undue distress or pain to the patient. From numbing a small area to inducing unconsciousness, the variety of anesthetics ensures that every medical procedure can be conducted smoothly and without pain. Now that we know the different types, let's explore the science behind how anesthesia works. At a fundamental level, anesthesia works by blocking nerve signals in your body. When these signals are blocked, your brain doesn't receive the messages that it ordinarily would about sensations like pain, touch, or temperature. This is why, under anesthesia, you can undergo medical procedures that would otherwise be unbearably painful. So, how does anesthesia accomplish this feat? It's all about the neurons. These are specialized cells in your body that transmit information to other cells. Anesthesia drugs interfere with the way neurons send these signals. They do this by altering the activity of certain proteins on the neuron's outer surface. These proteins, called ion channels, control the flow of charged particles in and out of the cell. When an anesthetic drug binds to these proteins, it changes their shape, disrupting the flow of particles and consequently, the transmission of the signal. Now let's briefly touch on the stages of anesthesia. There are four main stages: induction, excitement, surgical anesthesia, and recovery. During induction, the patient transitions from consciousness to unconsciousness. This is followed by the excitement stage, which can involve restlessness or delirium, but is usually bypassed with modern anesthetics. The surgical anesthesia stage is when the patient is ready for surgery, with no pain sensation and stable vital signs. Finally, the recovery stage is when the anesthesia is withdrawn and the patient gradually regains consciousness. Anesthesia doesn't just block pain signals, though. It also has wide-ranging effects on the body. It can affect your breathing, blood pressure, and heart rate. And it can also impact your body's stress response, which is why anesthesiologists monitor you closely during a procedure. To wrap up, it's worth marveling at how anesthesia, in essence, puts your body into a state of controlled, reversible unconsciousness. It blocks your nerve signals, alters your physiological responses, and allows surgeons to perform life-saving procedures without causing you pain. Anesthesia's ability to block pain and sensation is an incredible feat of medical science. Like any medical procedure, the use of anesthesia carries certain risks and necessitates stringent safety measures. Now, you might be wondering, what are these safety measures? Well, let's dive right in. Before anesthesia is given, healthcare professionals conduct a thorough pre-anesthetic evaluation. This involves a detailed medical history review and a physical examination to identify any potential risk factors. They assess the patient's overall health status, focusing on the heart, lungs, and any pre-existing medical conditions. This information helps them determine the safest and most effective anesthetic plan tailored to the individual patient. But it doesn't stop there. During the procedure, anesthesiologists or nurse anesthetists continually monitor the patient's vital signs. These include heart rate, blood pressure, oxygen levels, and body temperature. They adjust the anesthesia dosage accordingly, ensuring the patient experiences the right level of unconsciousness, pain relief, and immobility. Now, let's talk about the risks. Even with all these safety measures in place, anesthesia is not without its potential complications. These can range from minor reactions like nausea and vomiting to more serious issues such as allergic reactions, changes in blood pressure, or even breathing difficulties. However, it's important to remember that these risks are relatively rare. The field of anesthesia has advanced tremendously over the years, and the mortality rate associated with anesthesia is less than 1 in 200,000. That's lower than the odds of getting struck by lightning. Healthcare professionals work tirelessly to minimize these risks. They are equipped with the knowledge and skills to respond swiftly and appropriately to any complications that may arise. This includes being trained in advanced life support and emergency protocols. The goal is to make the anesthesia experience as safe and comfortable as possible for the patient, because at the end of the day, safety isn't just about the procedures and protocols. It's about the people who implement them and the patients who trust them. Safety in anesthesia is paramount, and healthcare professionals are trained meticulously to ensure patient well-being. Behind every successful anesthesia administration, there's a highly skilled anesthesiologist. Anesthesiologists are the unsung heroes of the operating room, the individuals who ensure that patients are not only comfortable during procedures, but also safe. They are the architects of comfort, the guardians of consciousness, and the sentinels of safety. Their role is multifaceted, encompassing more than just administering anesthesia. They are responsible for the preoperative assessment of patients, making vital decisions about the best anesthesia plan based on each patient's unique medical history, physical condition, and the nature of the procedure. Anesthesiologists undergo extensive training, often upwards of 12 years, to acquire the knowledge and skills necessary to navigate the complexities of human physiology, pharmacology, and the myriad of potential complications that can arise during surgery. This training includes a 4-year medical school program followed by a 4-year residency in anesthesiology, and often additional years of fellowship in a specific subspecialty, like pediatric or cardiac anesthesia. Beyond the technical and medical aspects of their role, anesthesiologists are also masters of communication. They are the comforting voice that patients hear before drifting off into the controlled unconsciousness of anesthesia, and the first voice they hear as they emerge from it. They provide reassurance, answer questions, and alleviate fears. They are also the patient's advocate in the operating room, constantly monitoring vital signs and making split-second decisions to maintain optimal patient stability. They guide patients safely through the beginnings of their surgical journey, stay with them every step of the way, and ensure a smooth transition as they wake up. Anesthesiologists also play a critical role in pain management post-operatively, using their expertise to help manage and minimize discomfort, allowing patients to recover more quickly and return to their daily lives. Anesthesiologists play a crucial role in the medical field, ensuring every patient's comfort and safety during procedures. They are the silent, watchful experts who blend science, medicine, and compassion to create a safe space for both surgeons to work and patients to heal. We have covered a lot about anesthesia today, so let's quickly summarize. We started by introducing the concept of anesthesia, a medical miracle that allows patients to undergo surgery without experiencing pain. We then explored the different types of anesthesia, from local to general, each with its unique purpose and application. From there, we delved into the fascinating science behind anesthesia, explaining how these powerful drugs work to numb our senses and induce unconsciousness. We also discuss the safety measures and potential risks associated with anesthesia, highlighting the importance of careful administration and monitoring. Lastly, we acknowledge the critical role of anesthesiologists. These medical professionals are the guardians of unconsciousness, ensuring patients' safety and comfort before, during, and after surgical procedures. Understanding anesthesia helps us appreciate the incredible work of healthcare professionals and the advancements in medical science.